All right, good morning, everybody. We're gonna get started here in just a minute. I'll let some people jump on as we see the numbers come up. Working hard here from the Chamber's perspective to do hopefully some last minute CARES Act grants for some of our small businesses and nonprofits here in Crawford County. So I'm coming to you from the Community Foundation for Crawford County here in Bucyrus. So I'm going to go ahead and let Stacy do some updates. Stacy, go ahead.
Hi, everybody. For those that don't know me, my name is Stacy Harrington. I am an employer services specialist with the Ohio Bureau of Workers' Compensation. What I do is I talk to employers about their workers' compensation premiums, how they're calculated, how to manage claims, and opportunities to save some money with the BWC. And to that end, I have some good news to share. For those of you who have not heard the announcement made by the governor a couple weeks ago, we are offering another dividend to Ohio employers that are eligible. This is going to be the biggest one by far. This will be the third one during this last policy year, and this is all in an effort to help employers that are struggling financially due to the COVID-19 pandemic that's happening. This particular dividend is going to be issued to employers. It will be 3.72 times your annual premium that you paid for the 2019 policy year. So the one that we just issued last month in October was 100% of your 2019 premium. This will be 3.72 times that amount. So if you have any questions about whether or not you're eligible and how much you might get, you can certainly reach out to me. I know that Miranda has posted my email and phone number contact information. I'm happy to answer any questions that you might have about that. But if approved, it will be issued sometime mid-December. And the thing to know that is different about this dividend than any of the other ones that were issued this year, the thing that is different is that this is not money that you paid in. So this is not a regular dividend. All the other dividends were money you paid in. We were giving you part of it or all of it back. This is money that we're giving to you that is over and above. So it's going to be considered income, and we will issue a 1099 for just this dividend that will be sent out in December. So tax purposes, you're going to get that 1099, and the dividend that will be issued is going to be something you're going to have to claim as income. So just so you're aware of that, and so you know to set aside a portion of that money for tax purposes. Okay. On to the next thing. Our Division of Safety and Hygiene has set up 2 more months worth of virtual training classes in December and January. I'm just going to quickly go over the ones that are going to be offered in December, and I will send to Miranda the flyer so she can forward it out to all of you folks. We've got Confined Space Assessment and Work going to be issued or held both on December the 1st and the 2nd from 9:30 a.m. to 12:45 p.m. These are webinars. So once you enroll, you'll be sent a link and you'll log in just like you do here at the Zoom meeting, but it's a WebEx event. Electrical hazard recognition and abatement is going to be on both December the 7th and the 11th, also 9:30 a.m. to 2 p.m. OSHA record keeping half-day workshop is going to be held on December the 16th, and that'll be 9:30 a.m. to 1 p.m. Those are our December classes. The flyer will also list some January classes, but I'm not going to go over those right now. Also, just wanted to make you aware that we are embarking on our 2nd round of mask distribution. So we issued the 1st round of mask distribution. We're going to be doing a 2nd round, and we have just started doing that. So it took us a while to get through all of the employers. We have over 250,000 employers in the state of Ohio. So it takes a while to get those out. Rest assured, if your policy is active, we will get to you. Make sure that we have valid address information. If you're not sure, or if during the pandemic you've changed the way some things need to be sent to your business, please reach out to me and I'll make sure that we have the correct address information for you. That's all I have for today. Thanks, Miranda.
All right, thanks, Stacy. Appreciate that update. Just so everyone knows, I am going to put Stacy's information in the chat So if you like kind of scroll on the bottom of your screen, I believe it's there. If you have any questions, please use the chat or the question and answer. But I do want to welcome Brad DeCamp. He is with our, is it Crawford-Marion ADAMH Board? Okay. And he's going to talk about mental health in the workplace, which I think is more important during this pandemic than ever. So thank you, Brad, and go ahead with your presentation.
Thank you very much, Miranda. I appreciate the invite. So I am going to go ahead and share my screen. I do have a PowerPoint that I'm going to share with you today. So I will go ahead and switch that over. And hopefully I can figure out how to do the slideshow from the beginning, and we'll get into this. Okay, so I've titled this Why Mental Health Matters, and we're going to get into some different information. What I am going to do is talk a little bit about the ADAMH Board, what it is that we do, and so I'll jump into that. And certainly feel free to ask questions as we're moving forward with the chat, and hopefully somebody will help me monitor that as we're going forward if they want me to stop. And again, please feel free to ask those questions if there's something that's not clear. So I'm going to start with a brief intro. This is a lot of stuff that's in the Ohio Revised Code, and so I'm not going to go into a lot of detail, but I did want to mention a couple things and then kind of sum it up in terms of what it is that the ADAMH Board does. But we're basically here to provide a support system for individuals who need either mental health or addiction treatment. And so that doesn't just include treatment services, that also includes prevention services. And so we'll talk a little bit about some of the things, some of the providers that we work with a little bit later in the presentation so that you have that information. But certainly we look at things like prevention, clinical treatment, counseling, medication, and the like, and then also services that will extend beyond clinical treatment, which could include housing and transportation and those types of things. So I'm not going to spend a lot of time on this particular slide. I did want to mention the third bullet talks about the personal liberty of mentally ill persons. And what I wanted to touch on there is that we do have a great deal of responsibility to ensure that if we are working with our hospital system or law enforcement around individuals who may be believed to be someone who suffers from mental illness, we do have certain time restrictions and other factors of the law that we have to follow in terms of how we protect that individual's liberties, because we are actually, they can have their liberties taken away for up to 72 hours if, again, there's this risk to self or others. So I'm not going to spend a lot of time more on that particular slide. Again, this says a lot of the some different things along those lines, but again, looking at working with our partners to develop this system for children, adolescents, and adults. And also an important thing is promoting the participation of persons receiving mental health and addiction services in the planning, delivery, and evaluation of the services. So the revised code is really pretty strong about making sure there's patient protection, making sure that we are including people who receive our services as we are developing them. And then just to kind of sum up, here are some things I would highlight. We do engage pretty heavily in community participation. I think that is something that would definitely include the Safety Council presentation, but certainly not just our board staff, but our board members are part of that as well. We recruit and promote local financial support, and we just had an election. I don't know if anybody knew this, but we did have our Marion levy on in Marion County, and so we were fortunate that we were able to pass there. The two levies are separate. Crawford County's levy passed in 2017, so thank you for those who support the ADAMH system. And then the last thing I wanted to touch on was planning to community needs. And I am going to touch on this a little bit more, but we are required to submit what we call a community plan to the Department of Mental Health and Addiction Services. And it really outlines what our priorities are and talks a little bit about what the resources are we use to develop those plans or those priorities. So we use the community health assessments. We're an active funder and participant in the community health assessment process in both Crawford and Marion counties. So in Crawford counties, we're working with Avita Health System, so the Crawford County Health Partners Group, if you're familiar with that, Avita, Galion City Public Health, and then Crawford County Public Health. And the overarching priorities that we committed to in our plan include trauma-informed approaches and resiliency, prevention, services to criminal justice, and then recovery support services. And so when we talk about recovery support services, those are those types of things that I touched on a few moments ago that are not typically thought of about an actual counseling service or case management service. These are things like housing and transportation and other things that typically fall outside of that, what you might think of as being provided in a traditional community mental health center or other provider. With respect to Crawford County, we have actually done not only the community health assessment, but we were fortunate enough to get our community health improvement plan, or CHIP, done before COVID hit. And so we actually ended up focusing on two particular goals. The first goal is mental health and addiction, which we were very excited to see, but you will see some of the things that this includes. It's a pretty wide-ranging category. And then we also looked at chronic disease. Those are also some things that have separate categories within that broad category, or subcategory, sorry. So in terms of the actual mental health and addiction priority area, we're looking at some things like creating an overdose fatality review board in partnership with the health department, providing trauma-informed care and additional training opportunities around that topic, information around suicide screening and depression for employers and healthcare providers, which I will touch on in more detail a little bit later, parenting programs, universal school-based suicide awareness and education, and also reducing tobacco use. So that covers both the chronic disease and mental health and addiction area. So now we'll start to transition into some of the other things that I wanted to share specifically about mental health statistics and some things that go on. This is from, I believe, National NAMI, the National Alliance on Mental Illness, looking about the numbers and statistics that, that we know of. We know that 1 in 5 in America will experience a mental illness at some point in their lifetime. So that's 20% of us will have to deal with that. Nearly 1 in 25 deal with a serious mental illness. So this would be something like major depression, schizophrenia, and a few other categories as well. And then 1/2 of all chronic mental illness begins by the age of 14, and 3/4 of that begins by the age of 24. So what that says to us is that if there are ways that we can work with, whether it's the healthcare system through Avita or other primary care physicians that aren't affiliated with the health system, so that we can start to look at identifying things like depression or maybe trauma, looking at adverse childhood experiences scores, so that we can begin to stage those interventions earlier, the better. So mental illness or mental disorder, it is a diagnosable condition. And what we're saying here is that it definitely affects different areas of a person's being. It's their thinking, it's their emotional state, their behavior. It can be very disruptive to their ability to work, just carry out any daily activities that we might think of as being something that would be ordinary, or engage in satisfying relationships. So those types of things it can definitely impact. I really like this particular graphic. I've not found a good way to get it into PowerPoint, so I apologize for it looking a little wonky. But I think this is good because it's important to point out, I believe, what you may see as opposed to what may be actually happening if you think you're dealing with someone who may be experiencing a mental health disorder. But you could see something where somebody is just maybe not being a good friend. Maybe you're thinking, well, this person, they can't commit to doing this or that or the other. And again, some of this was, I will qualify this by saying some of this was pre-COVID. So now we're dealing with a whole other myriad of complications. But maybe also appearing lazy or not wanting to get out of bed, maybe seeming like they've got a bad attitude or that they're rude to people, being distant, canceling plans at the last minute. But what may actually be happening is you could see that someone who is self-isolating due to mental illness or trauma, they could be really struggling, but they don't have the energy. There's this extreme exhaustion or fatigue. And it sometimes makes them, the symptoms can be so paralyzing that it really freezes them and makes them want to just, really not move. So there is this, I think, connection between mental and physical. So what you may think of it as more of a mental health issue, but it definitely has some physical complications as well. Mental health conditions typically aren't just the result of one event. It's a combination of things, including genetics, environment, and other issues. It can influence There are things like stress with your work or home life, and other traumatic events like being the victim of a crime. And it really does, change the way that the brain structure is able to process those types of things when those types of things do occur. So now let's talk a little bit about common mental health conditions. And normally, if I'm doing this live in front of people, face-to-face, I guess is maybe the correct term that I'm struggling with, I would ask, what are some of the what would you think is the most common mental health condition? And a lot of times, I think people tend to think about the more serious conditions like bipolar or schizophrenia as being more common than they are, but really it's anxiety by far. And those are the most common of the mental illnesses, then depression, and then followed by bipolar and then schizophrenia. So those are typically how those play out. So we'll talk a little bit about those, each of those categories in a little bit more specificity. Anxiety disorders, again, they're the most common. It's estimated that over 40 million adults have an anxiety disorder. The different types of anxiety disorders that you can look at are just generalized anxiety disorder or social anxiety. There's also panic disorders and phobias as well. But again, those are the most common in terms of looking at a category of diagnostics or diagnoses. My apologies. Depression is another big one. Again, this affects almost 7% of the population. And what we see with depression, and some of these are what I touched on a few moments ago in terms of what you're seeing as opposed to what's actually happening. Changes in sleep, appetite, inability to concentrate, lack of interest, or things that may have been something that really kind of got someone interested before, hopelessness, changes in movement, physical aches and pains. Again, there is a connection between depression and then not just what's going on in the brain, but also physically, feeling those types of aches and pains and stuff that do come up. And then we also do see suicidal thoughts with individuals who have depression. PTSD, post-traumatic stress disorder, this is one that certainly is, I would say, growing. It affects 3.5% of the adult population. So again, not a huge number comparatively speaking, but certainly it's something that's not insignificant. Typically we see women have higher rates than men, but looking at those types of things that can sometimes contribute to that would be like things like an accident, an assault. So military combat, being in active theaters of combat, or other natural disasters can have a lasting effect on a person's mental health. And it can be something that can coexist with other conditions. And so what it's not uncommon to see is, PTSD and then substance use. So someone may use drugs or alcohol or something like that to help mitigate those complications of PTSD. And again, often goes hand in hand with depression and anxiety as well. Eating disorders, again, something that are not uncommon at all. We have anorexia, bulimia, and then binge eating. Those are just a couple of things that we do see with eating disorders. But again, those are things that do come into play. Schizophrenia, it is one of the more serious categories, and it interferes with the person's ability to think clearly, manage emotions, and make decisions. It is a complex and long-term medical illness, and I apologize if you're hearing a train in the background. I am not too far from the train tracks from where I'm presenting, so I apologize. But again, it does require long-term medical treatment. What we typically see with schizophrenia is that you have this onset of late teens to early 20s for men, and then late 20s to early 30s for women. This is a bit generalized, but again, that's typically what we look at in terms of onset. And while it's uncommon for schizophrenia to be diagnosed in a person younger than 12 or older than 20, that doesn't mean that it can't occur. But again, those are just kind of the general guidelines in terms of onset and what we see with schizophrenia. Dual diagnosis is where you will have something that you'll have the mental health issue, but you'll also have a substance use disorder. And like I touched on a few moments ago with the PTSD, a lot of times what will happen is you'll have this maybe use to mitigate some of the symptoms that are going on with the PTSD. And then if that is not, if that becomes a maladaptive pattern or something that's done too much, then you could have a full-blown substance use disorder that then occurs simultaneously with the PTSD. But again, so when we use the term dual diagnosis, a lot of times what we're talking about is that the mental health disorder along with substance use disorder. You will sometimes see dual diagnosis used in terms, though, of mental health and developmental disabilities. So that's another time where you might see that type of term or use of the term dual diagnosis. But it is fairly common a lot of times, especially if you look at individuals who use our services from the criminal justice system, you will note that there is substance use disorder along with mental health issues. And I think a lot of times some of the challenge that we have with criminal justice especially is it may be a drug-related charge or something like that that gets them into the criminal justice system or a run-in with law enforcement. But many times there is an underlying mental health issue that is not being dealt with or has been addressed at this point in time, or they may not even know that has occurred. So just to sum up as far as that goes, mental illnesses are diseases of the brain. They affect mood, thought, behavior, and judgment. And we find in many cases that medication and counseling or psychotherapy work best, along with social supports and self-help. And so I think that you'll find that that's true not just with mental health, but also with addiction as well. Typically, it's a combination of those different types of portions of what we would look for in a treatment plan. And the support is also very important too. I think that it's not uncommon for someone to go maybe get medication and counseling and feel better, but in terms of really kind of instituting a long-term change and making sure that that helps, it's really good for people to reach out and be part of groups and really start to feel that connection, because that's what it does. It builds that connection and it makes it less likely for someone to isolate and have their symptoms get worse. And lastly, mental illnesses are treatable and recovery is possible. One of the things I wanted to spend a good bit of time on, and the amount of time that I have left, is that we do have increasing suicide rates across the country. So we'll talk a little about some local data with that as well. But there was some information that was released about just short of 2 years ago that looked at the overall rates of suicide from 1999 to 2016. And so this would have been released in 2018. And so this is just some statistics about suicide and the rates and how they've increased. And we'll look at Ohio and then some Crawford County data here in just a minute. Generally speaking, you're not going to have a single cause, or at least in terms of mental health conditions, but it's something that is really complicated and has a lot of moving parts to it. So, and it's not uncommon for folks who die by suicide to not have been diagnosed with a mental health condition at the time of their death. And again, we talk about the other complicating factors such as relationships, substance use, health, obviously economics and jobs are going to be a big part of that as well. Here are some of those factors a little bit more specifically in terms of their frequency. Relationship problems, especially with younger people, that is definitely something that is can be problematic. A crisis, a health problem, criminal justice, job, financial, and then also problematic substance abuse. So those are all contributing or can be contributing factors. These are just some additional statistics. I'm not going to belabor these, although this 30% factor, so or figure, this middle figure here, went up. So the suicide rates went up by more than 30% in half of the states since 1999. Okay. This just shows kind of the layout of where the different states are. You can see where Ohio is here, and we were in the 31 to 37% increase in the CDC report that was released in 2018. These are the warning signs. So I'm not going to go through all of these, but these are the types of things that you might see or hear from someone who could be at risk. So things like feeling like a burden or making statements that they feel like a burden, isolating, knowing that or noticing increased anxiety, increased substance abuse, access to lethal means, actually specifically stating a plan, and just, some of the other things that we can look at, like actually making a post on social media about wanting to die or something along those lines. So these are the warning signs that are typically present. We're going to talk about some other types of interventions, but generally thinking, one of the things that I always want to point out is that I think that there is this preconceived idea that if you ask someone if they are seriously considering suicide, that in some way is going to make them more likely to complete suicide, and actually the opposite of that is true. And that's why it's important that we begin to talk about these types of things and make sure that we are giving the community tools to help recognize and have ways to have these conversations. So generally when you're asking, what you're doing is you're reaching out and making a connection to someone and helping reinforce that, which is so important. But also keep them safe, be there, help them connect, follow up. So we'll talk about a few more specific items along those lines as we move forward. These are a couple of resources. Kate Seifert at Crawford County Public Health had done a report in 2018. So their report is online. And then we also have a longitudinal analysis by the Ohio Alliance for Innovation in Population Health. So I'm going to show you a map that was actually taken out of one of those reports. This is actually the suicide rates per 100,000. So you can see Crawford County here and Marion as well. So we are genuinely concerned about those rates. You can kind of see in terms of technically in the low category, but pretty close to where that cutoff is. And so we continue to monitor that. And as you noticed from the Community Health Improvement Plan slide that I showed earlier, that's something that we want to continue to make sure that we're focusing on, is suicide prevention. This is a map that shows years of life lost. And so what we're looking at with this particular slide is, if you were to take the average life expectancy and then apply that to the time of, or the age of someone who would have died by suicide, what would be the difference? And so as you can see in Crawford County, that's just sort of 2,000 years of life lost from 2008 to 2017. And when you combine that with Marion, it's over 5,000 for our board area. So that's something that we're definitely concerned about. One of the things that we've done pretty successfully in Crawford County is work with this program called Signs of Suicide. So this is an evidence-based program. It's a universal prevention program that's being done in the schools in Crawford County. CCS is providing this, community counseling services, I believe in all districts but one. And so it's really designed to be a screening, and then to identify those who may be at heightened risk for suicide, and then connecting those individuals with appropriate services if they do screen at a higher at-risk level. So the goals of SOS are to decrease suicide and suicide attempts by increasing student knowledge, encourage personal and help seeking for themselves or on behalf of a friend, reducing the stigma around mental illness and acknowledging the importance of getting help, engaging parents and school staff as partners in prevention through gatekeeper education, which we'll talk about a little bit later as well, and encouraging schools to develop community-based partnerships to help support student mental health. So those are the goals of the Signs of Suicide program, and we've definitely seen an impact in our local community as a result of this in a positive way. Another program that that we do provide within our board area is mental health first aid. And so we have mental health first aid at work that we can also provide. But it's an 8-hour course, and it can be done in a full day, or it can be done in 2 half days. And so we'd often, apologize about that. We often will have folks who will say, okay, we'll prefer the half day to a whole day. Although I will say with the COVID world and doing Zoom and providing trainings virtually, that's something that I think we're trying to reevaluate in terms of what's the best mode. Obviously, being on Zoom for 8 hours at a time is a pretty tough thing to do. And so I think we're just kind of adjusting to that and seeing how we can adjust to that. But again, mental health first aid, it is something that can be offered. And the goal was to really make it as common as CPR by the year 2020. And so we've seen certainly a lot of growth in mental health first aid. What it covers: common signs and symptoms of mental illness, substance abuse, how to interact with somebody in crisis, and then connect them to help. And one of the more recent things it's done is how to administer naloxone in the event of an opioid overdose. And so that's in recognition of the things that we've been dealing with over the last few years. Here's just a side-by-side of mental health first aid and youth mental health first aid, which can also be provided to for youth as well. So I'm not going to go through all of the different bullet points on that, but I will provide this to Miranda, and you're certainly welcome to have access to this after we're done. Mental health first aid uses the ALGE action plan, which is approach, listen, give, encourage appropriate professional help, and encourage self-help and other support strategies. But it's really, again, about asking the direct question, listen without judgment, give reassurance and information, engage emergency services as appropriate, and then encourage them to get help and also other support. I wanted to touch on Working Minds. This is a newer suicide prevention program in the workplace that we can offer. This is something that is currently being offered by Marion Crawford Prevention Programs. And so I can provide individual or the contact information for this once we're done. This again is something that is a 2-hour training, and it's basically going to work through some of give the background for why it's important in terms of having this information available in businesses, and then creating a forum for discussion and how to promote individuals who want to get help and what can be done there. So we are looking for businesses in Crawford County. So if you're on this and you're interested in learning more about Working Minds, please reach out to me, and I will connect you to Christy Eckert, who some of you may know in the Galion area, and she's with Marion Crawford Prevention Programs. I did want to also touch on very briefly the Substance Use and Workplace Recovery Program. This is offered through the BWC, and so Stacy was on earlier, and I'm working with her colleague Jim Wise, and we are looking to recruit businesses. I believe Jim has been planning to get in contact with Miranda, and I don't know if he's been able to do that just yet, but we've been working to recruit businesses. And really what they're looking at doing is reimbursing businesses for costs that they may have associated around training and policy development and supervisory training as well, and also drug testing. So this is a good program. It is definitely something that is, I believe, that can grow in our area and be utilized by businesses. So we'll be looking at how we can tap into that and make better use of those funds here very soon. Obviously, COVID has been on a lot of our minds, and so I'm going to go through some of these things a little bit more quickly to just kind of run through it. And I do want to kind of close at the end with some things that we're looking forward and what we might be able to do to help address some of these concerns. Again, I think a lot of what we've seen in terms of, we have the economic issues as well, but we have this, I think, just whole piece around collective grief and loss. And so I've had some issues in my family with death and with health, and it's just been really a struggle, because these are types of things that aren't easy in our human condition to deal with ordinarily. And then you begin to take away some of these institutions that we have developed over time in terms of how we grieve for our loved ones when they're no longer with us, and we can't celebrate the other things that you know, are good in our lives on the other side of that. And so I think we've all been kind of dealing with that. And then I think the whole notion of physical distancing is challenging. We're individuals who thrive on contact and connection, and so that's made it challenging as well. Definitely, we've seen this play out, and I will give you a slide on this one in just a minute. But I think that certainly there's risk for developing a condition, whether it's depression, anxiety, a substance use disorder, or PTSD. It's also risk of worsening conditions, and so it's important, again, to identify warning signs and encourage people to get help if they feel that they need that. And then also relapse, and certainly that has been borne out in the statistics as well, and we'll touch on that in just a moment. But again, this isn't something that I feel like I'm preaching to the choir a little bit on this one, but in terms of definitely economic losses and in terms of driving lower productivity, increased healthcare costs, and higher mortality. And there is an estimated impact of about $1 trillion a year in terms of lost productivity across the world. So here's some of the survey data that I was just referring to in terms of the risk of developing a condition, relapsing, and then getting worse. You know, 40% of adults have reported adverse mental health conditions as a result of COVID-19. Here we're talking about younger adults, especially essential workers, and some others who've reported worse mental health outcomes. And then specifically, we have 31% who have reported anxiety, depression, 26% reported trauma and stress-related disorder related to COVID-19, 13% having started or increased substance use, and then a very concerning 11% have reported seriously considered suicide in the past 30 days. So these are all things that that I believe were predicted and have unfortunately been borne out. So what can we do? What are some of the things that we can do to work together to begin to think about how to combat this, as it looks like we're going to be dealing with it for a while? In terms of employers, I think certainly normalizing these types of discussions around mental health and recognizing that they are real and can affect individuals and families. You know, making sure that as a business, if you have policies around having individuals being able to access appointments or go on work time to do these types of things, that is supported. Also looking at EAPs and other access to substance abuse and mental health care. And also just, I think, creating that leadership and having the ability to have those conversations are things that go a long way. Sharing signs, common signs of mental health conditions, early warning signs, promoting, again, access to services, normalizing that conversation of it being okay to ask for and receive help. Looking at stress management strategies, so talking about things like meditation and mindfulness and how we might be able to incorporate that in the workplace. Some of that's going to be obviously dependent on the type of business that you do, the industry, but if there are things that can be done to help promote that, that would be helpful as well. Looking at promoting resiliency and different strategies there, and also employee resource groups where you know, the individuals can have that safe space to maybe come together at the workplace and talk about different issues. So those are some suggestions that we have. You know, building resilience, you know, resilience first and foremost has physical and mental components, but certainly if we can do things to, you know, support resilience and look at how we can work together to do that, that's going to go a long way. We at the ADAMH Board are looking at how we can develop skill building groups for resiliency, and that's something that we're going to continue to focus on. We've not been able to implement those just yet. But that's something we are going to continue to focus on in 2021. So as I begin to wrap up, I do want to share some resources. These are, so we have the National Suicide Prevention Lifeline, 800-273-TALK. We have the Crisis Text Line, which can be accessed by texting 4HOPE to 741-741. We do have our Crisis Hotline and Information Referral Line in Crawford County. I have both the Bucyrus and Galion numbers there. We have community counseling services. That's their main number in Bucyrus that's there. I did want to mention that we do have some additional behavioral health providers, and this is a list that includes Marion County as well. The ones with the asterisks, so New Day, Family Life Counseling, and Affinity, those are ones that are particular to Crawford County. So those are some additional treatment resources that have become available within the board area. And then some additional resources in terms of national institutes, both on mental health and drug abuse. We have the NAMI website, which is really good and a great resource for families. And then we also have the mental health first aid website as well. As I close, I wanted to just make a few comments about looking ahead. We've talked a lot about suicide prevention, and that's something that through our CHIP, our Community Health Improvement Plan, and also the board's community plan, we're going to continue to focus on. Looking at QPR and also open minds. So QPR is question, persuade, refer, and that's part of our Community Health Improvement Plan. That's also something that we can provide locally. It's in 1 hour training. The open minds is 2, but the QPR is 1. And looking at how we can incorporate that into businesses as well. We do offer the science of suicide, and we'll continue to do that. We're looking at the creation of this kind of regional loss team, which is local outreach to suicide survivors as a support to families. And that's something that we're partnering with our sister board in Delaware and Morrow counties. And then in the long term, we are looking at developing a more modern permanent supportive housing project that will serve both Marion and Crawford counties. The board does own some properties in both Crawford and Marion counties, and we're looking at how we can provide a more modern project that can provide an adequate number of beds for individuals who are looking for housing. And these would be individuals who have more significant mental health issues. Just some parting thoughts that I wanted to leave you with. I think obviously we've touched on COVID-19, and it's something we hear about every day, whether we want to or not. But it's going to be part of our society. And so the one stat that hit me very early on, and I touched on this earlier, was although 1 in 5 we know will develop a mental health condition at some point in their lifetime, 5 of us will experience, will have experiences that will not affect our mental health in a positive way. And I think about a lot about COVID-19 and that as well. But it has impacted our delivery of services. We're doing a lot more via telehealth and interactive video conferencing, which is a good thing and a bad thing. I think it certainly made services more available, but I think for certain populations, it's more challenging. Medicaid expansion, as I mentioned earlier, we did have an election, and obviously there will be budget discussions and legal things that will be going on. But one of the things that I would say unequivocally is that Medicaid expansion has been very good for behavioral health care. We have a lot more people who have coverage and are able to receive services. Workforce development, this is an issue that is huge for us in the behavioral health field, as we find it challenging a lot of times to find individuals who are willing to be in both Crawford or Marion counties. A lot of times they can go maybe a little bit further south or a little bit further east or a little bit further north and make more money. And so that's something that does make it a bit challenging, and we're trying to work on how we can maybe stabilize that a bit for our provider system. And then lastly, specialized services. How can we better respond to youth? How can we better incorporate peers? And then for inpatient services, do we need to develop a local asset in that regard? Since we don't really have that in terms of like a residential program, rehab program. I want to thank you again for allowing me the time to come out or be on the computer, sorry, and chat with you about these different issues. If you have questions, please feel free to call me. The best way to get me right now is on my cell, the 419-310 number, but you also have my email. And lastly, if you have not checked out the ADAMH Board website, we did redesign that over the late summer and early fall, and we've given it kind of a spruced up look. So I would encourage you to check that out if you've not.
Thanks,
So
Brad.
yep.
We do have a couple questions come in.
Okay.
So one is from the school's perspective. So are there any suggestions how to approach an adult or a parent that has a schizophrenic diagnosis when they are not open to or receiving any treatment?
Yeah, so the parent, let me stop my share and see if I can actually go over here. Okay, hi Jen, thank you for that question. Yeah, that is that's a challenging issue because you know, one of the cutoffs that we look at is the individual a risk to themselves or others. So if they are if that becomes an issue, if it's an issue of interfering with their ability to parent, or if you feel that the student is at risk, then that is a point where we could maybe look at instituting or calling in for welfare with law enforcement, engaging. So if they're in the city of Galion, the city police department, and working with them to make sure just everything is going on. But I think obviously we would want to leverage family if there's family. If not, then I think trying to provide the education through the student to the parent, and again, it's a fine line because that's going to be a challenging thing. But one of the things that again does come to mind is just that notion of safety, especially if there's a young adult, a young person involved, making sure that they have that opportunity. And what could happen through that is there could be some engagement through the healthcare system then to help address the mental health issue. But ultimately, we do have to, as I pointed out earlier, we do have to respect that individual and their civil liberties as much as we can. Obviously, if safety does become an issue, then that's another thing. But I'd be happy to chat maybe about some other ideas offline. Maybe we could engage one of the providers to see if there could be some other support that could be given. But I do appreciate the question.
We did have another question as well, Brad, but thanks for that one. And this one's in the Q&A at the bottom if you wanted to look.
Okay.
Is it common for a patient to be diagnosed with more than one of those issues you were discussing?
Yes, it is. And it's, did you want me to do something, Miranda? I see something popped up.
I just hit the answer button. Sorry, you're good.
Oh, okay. Can you still hear me okay?
Yes.
Okay. All right. Sorry about that. Yeah. So it's not uncommon at all. In depression and anxiety, there's a co-occurrence factor that occurs there. Having them both is very challenging. And again, it's not uncommon sometimes to have someone maybe with PTSD or anxiety and depression to have substance use disorder. Well, if not a mild substance use disorder, then maybe some abuse or maybe not inappropriate use, but maladaptive use. So using more than what you would expect to use on occasion, or using more frequently over time. So yes, it's not uncommon for those to co-occur as well. And I did see another one. Company works. Yeah. So yes, there is the. They are working on the national suicide number, so that will be 988. So there will be a national suicide line that will be operational. The 800 number that I shared earlier is a national number. Let me go back and see if I can pull that up real quickly. Oh boy, sorry about that. Yeah, so the 800-273-TALK, 8255, so that's 1-800-273-8255. That number is a national number. And again, we will have the 988 number that was recently passed by the Federal Communications Commission. There still has to be some funding that'll be provided for that, but that'll basically be like the 911 for suicide once that becomes funded.
Are there any other questions from anyone? I'll give you just a second. I just wanted to take a minute though to thank you, Brad. I know you guys, right now it's so hard. And I think we all feel that way, and we all are, trying to figure out the best way to help everybody that we can. And just making sure that we all know that, from a chamber's perspective, I'm always here for you. I know Brad is always there. And I know my counterparts throughout the county are as well. So any questions, don't hesitate to ask or reach out to anybody. We can get you in touch with the right people. So
Absolutely. Yeah. Feel free to reach out. We're here for you. You know, I appreciate again, Miranda, for the invite and for having us come out. And I think if nothing else, I guess the takeaway would be, we're going to be in this for a while. I think it's important, as Miranda said, to lean on each other as best we can. But I think anything from a business perspective you can do, again, to help normalize these conversations in the workplace and make sure that people feel comfortable, I think will go a long way.
Wonderful. If no one else has questions, we will end this for the day. I will send out the information that Stacy talked about at the beginning about the upcoming BWC virtual opportunities. And Brad, if you can send me your PowerPoint, I will send that out as well with a link to this video once we get it uploaded to our YouTube page. So thank you all. We'll see you again next month.